Not everyone in scrubs is a nurse. Not all nurses have the same level of responsibility. Three main ones you may see in a healthcare setting: CNA, LPNs, and RNs. Let's get into what the difference is. Now, each one has their own different roles with three different levels of responsibilities, trainings, and scope, but we're all essential. CNAs assist with activities of daily living. This may look like bathing, feeding, toileting, hygiene, repositioning or mobility, ambulation, and vital signs. LPNs, they are a nurse, right? Licensed practical nurse. This is a 2-year degree. This is nursing care performed underneath the RN supervision. They cannot give certain medications like IV push medications, blood transfusions, and or start IVs in certain states. But with nurses, LPNs, and RNs, nurses follow what we call the nursing process. So that is assessment, diagnosis, planning, interventions, and evaluations. LPNs are included in this nursing process, however, they're not allowed to do the first assessment. So this would include getting a new patient or admission. LPNs are also not generally allowed to do blood transfusions, IV push medications, and or IV starts, just depending on the state. So you have to check your Nurse Practice Act for each state just to make sure you know what the LPN is able to do. Now, RNs, that stands for registered nurses. Registered nurses have a full scope. They're able to do the full nursing process. They can do admissions, do the first assessment, do blood transfusions, start IVs, IV push medications, and coordinate care throughout the discipline. They carry the final legal responsibility for patient outcomes within the setting. The RN actually has the CNAs and LPNs working underneath their license. So it's important as an RN that you make sure that the charting is all equal to yours and that you're notified of any status changes, plan of care changes, and medication needs, because you are the final stop generally for patients. So these are different roles. So these are three different roles with different scopes, different accountability, but all three essential. If you ever wondered about what's the difference between a CNA, LPN, and RN, this video is for you. Hey, my name is Nurse Key. I'm an RN. I started off as an LPN, now I'm an RN, and I'm in NP school. All right, so let's talk about the scope of practice. So CNA focuses on the activities of daily living, which includes bathing, feeding, toileting, repositioning, ambulation, mobility, and basic vital signs, right? LPNs and RNs use the nursing practice, which consists of assessment, nursing diagnosis, planning, intervention, and evaluation. So LPNs, they actually provide nursing care under a RN supervision. LPNs is just a 2-year. LPNs is a 2-year degree. LPNs, while they do follow the nursing process, they're not able to do the initial assessment of a patient. So that means admitting a patient, and they also have some skills that they're not able to perform: blood transfusions, IV starts, and IV push medications, just depending on the state that they practice in. LPNs, they're able to give the rest of the medications, perform treatments, they can monitor your patients, and report changes. And so it's essential that you actually know what your scope of practice is for your state. Now, RNs, they have the full scope of the nursing process. They can do the initial and ongoing assessments. They can initiate IVs, administer IV medications, and blood transfusions. They can interpret patient changes and coordinate the overall plan of care. So ADLs versus nursing process, this is kind of the difference between the CNA, LPN, and RN. I hope this is clear. Hey, if you're trying to choose your path in nursing, this video is for you. Let's go over how the CNA, LPN, and RN roles look like on an educational path. So CNAs, This stands for Certified Nursing Assistants. They go to school for about a few weeks to a month. They do have to take a state board exam to pass to get their license, and they generally focus on basic patient care that deals with activities of daily living that looks like feeding, hygiene, mobility or ambulation, toileting, and things of that nature. Whereas LPNs and RNs, those are nurses and they focus on the nursing process of patient care. LPNs, they have to sit for the NCLEX practical nurse exam. RNs have to sit for the NCLEX RN exam. So LPNs, they generally go through school for about a year, and those programs are offered through a technical college or community college. And LPNs, they have almost the same scope of nursing as registered nurses, but they're not able to do the initial assessment of patients. They can't do certain skills like blood transfusions, IV push medications, or even start IVs, just depending on the state. So by each state, they all have their own requirements of the LPN scope. Now RNs, the RN programs take anywhere from 2 years to 4 years. A 2-year program is called an ADN. 4-year programs are called BSN. So either way, regardless of which one that you achieve, the RN has a full scope of the nursing process. This means assessment, diagnosis, planning, intervention, and evaluation. RNs do the initial and ongoing assessments. They do critical thinking, leadership, and they may be in research. So it just depends on which pathway you want to take, what you're interested in doing on the side of patient care, and how far you want to take it. All three are great roles. All three are essential, but all three have different pathways to get to be achieved. I hope this helps. Let's talk about what CNAs, LPNs, and RNs actually make. We're talking about hourly, yearly, and what are the best states to work in. Hey, my name is Nurse Key. I started off as an LPN and now I'm an RN going to NP school. Alright, so CNA pay. Typically CNAs start anywhere from like 18 to 20 nationally, but of course, there's range within there. That comes out to about 38,000 to 41,000 a year. Now, location is everything. The highest paying states for CNAs is the DC area, about 23 an hour, Hawaii, Alaska, California, Oregon, and New York. And all of those are separate licenses. Now, there's even levels to it. You could be a local CNA, you could be an agency CNA, which means that you're working at different facilities, and then you can actually be a travel CNA. So there's even levels within that position. Now, LPN, licensed practical nurse, we'll talk about that pay. Typically, LPNs, they earn about 28 to 32 an hour. And I think my first job as an LPN working in a post-acute facility started off as $21 an hour, and I was happy to get that. And then a night shift differential is like $1, $2, and then if you work weekend, it's like $1, $2, depending on your facility. But typically the average for LPNs is 28 to 32 an hour, and that comes out to about 60 to 65,000 a year. The best states for LPNs are New York, Massachusetts, Rhode Island, and Washington, California, and Alaska. And all of those actually are individual states. Those are not, I don't believe, in the compact license for nurses. Lastly but not least, registered nurse. Registered nurse is the highest of all three. It starts off at 45 to 55 an hour, and this comes out to about 90 to 115 per year. My first RN job out of school for a new RN, like graduate nurse program, was I think 40 or 45 an hour, and that was in Georgia. And the top states for RN pay is California, Hawaii, Oregon, Washington, Massachusetts, and New York. So really, it's not where you start, it's where you finish. And so you have to kind of learn how to maneuver. You may start like with a low paying job, but at least get the experience. Once you get the experience, you can kind of do agency, which allows you to work at all different type of facilities. And then you'll start to earn more. And then the biggest jump is going to be into travel nursing or travel CNA, doing travel contracts. Generally anywhere from 8 weeks to 13-week contracts. And you'll get a stipend based on your travel. And then a lot of people think you don't get health insurance, but that generally do get health insurance if you select that in your contract. So I hope that helps. Not everyone in scrubs is a nurse or a doctor. Here are 7 healthcare jobs you probably didn't know existed. Clinical lab scientists are real scientists that work behind the scenes analyzing your blood, urine, and cultures under a microscope to guide diagnosis and your treatment. Number 2, phlebotomists. These are the people that come and draw your blood, making those labs possible. Without them, there are no blood results. Number 3, EKG and telemetry monitor techs. These people, they watch your heart rhythms around the clock. They check for any life-changing rhythms, and they call the nurse to get them to bedside and to treat whatever is going on with the patient. Number 4, respiratory therapists. Now these are the individuals that manage oxygen, supplemental oxygen, your breathing treatments, and they just overall monitor your respiratory status. Number 5, radiology technicians. These are the people that perform x-rays, CTs, and MRIs, and they can confirm what's going on inside the body. Number 6, pharmacy. So either the pharmacist or pharmacy tech. These people, the pharmacist verifies the medications after the doctor orders it, and the pharmacy tech, they'll prepare the medication, which means they'll either count it or draw it up or prepare the bag, and then send it to the nurse to administer it. Now lastly, case manager and social workers. These people, they coordinate safe discharges for our patients, and they help with the overall long-term care plan to make sure that the patient doesn't continue to be readmitted or have to see acute care. Now, all in all, like I said, everybody in scrubs is not a nurse or a doctor. Healthcare is not just one role, it's a team, and every role is important. Can I tell y'all about a secret healthcare job that nobody ever talks about, but everybody depends on? Clinical lab specialist. Now, the other day I was at work and I had to go to the lab to drop off my, to pick up. Now, the other day I had to go down to the blood bank to pick up my blood for my patient. And I was talking to the guy there about, what do they do down here and all the things. And he told me he's considered a clinical lab scientist. Now, clinical lab scientists, I've heard of that, but I didn't realize they were actually scientists. So with these positions, they actually require a bachelor's degree in biology, chemistry, or a medical laboratory science. And then the hospital will train them on site, and then they'll earn the certification. So part as it's kept, this is a highly sought after position, but they're actually severely understaffed because a lot of people just don't know about these positions. So I'm spreading word. This position is highly paid. It may take, I think, 2 to 4 years to obtain. You have to get your degree and then you have a little bit of training afterwards. But once you get the training, you're in there. So let me tell you what the job does. So these are the people that actually, they collect your samples, blood, urine, all your other specimens, and they run it under a microscope. So the people in the lab, they could either be literally microbiologists, chemists, hematologists, and even working in the blood bank. So while as nurses, we know that we draw labs, but we never think about what actually happens when we leave it or we send it to the lab. I don't know, I just thought sometimes the machine will analyze it, but no, there are real humans in the lab analyzing every specimen under the microscope and giving you the results. That way, that's why when they say that they can't analyze it, they mean literally your specimen is hemolyzed and they need a better sample. Something to think about. Today, on Not Everybody Wearing Scrubs is a nurse or a doctor, we're going to talk about phlebotomists. Alright, so phlebotomists, we know they draw the blood, right? Got to be very good at getting to the vein, getting blood return, and sending the lab down for to be analyzed. Phlebotomy is one of the quickest entry points into healthcare. So usually the basics, you need a Okay, so the basic requirements: you need a high school diploma or a GED. No college degree is required. You're going to take a phlebotomy training course. This may take up to 4 to 12 weeks and is offered through multiple colleges, vocational schools, hospitals, or private training. These trainings are going to teach you venipuncture. That means to look at the vein, get blood return, safety, infection control, and patient identification. You're going to have hands-on experience. You're going to have supervised blood draws, first with a mannequin and then on real patients. Phlebotomists are excellent at their job. When nurses cannot get not get the labs, phlebotomist comes in under 5 minutes. They've already got it. So they are very trained, very skilled at what they do. Now you are required to be certified in most states. And it doesn't help. It doesn't hurt to just get it anyways, right? You want to say that you're an expert in what you do, get the certification. So some employers will allow you to get it through different agencies, and then some states often mandate certifications. Now you're going to apply through your jobs. Now phlebotomists, they can work anywhere and everywhere: hospitals, labs, clinics, blood banks, and even with animals. It doesn't have to just be humans. You can even work at outpatient centers. So you have a lot of entry-level roles that are available throughout the states. Now, this is fast, affordable, and it gets you real patient experience, especially if you plan to move into nursing or another healthcare role. This is one of the fastest ways to get into healthcare. Are you thinking about becoming a phlebotomist or another healthcare role? If so, let me know in the comments.